পর্যালোচনা বা ব্যাখ্যা এই বিষয়ের উপরে আলোচনা উপস্থাপন করবেন ডক্টর শেখ ফারুক ইলাহি স্যার। আমি স্যারকে আলোচনায় আমন্ত্রণ জানাবো। তার আগে আমরা যারা উপস্থিত আছেন প্রত্যেককেই অনুরোধ করবো আপনাদের মাইক এবং ক্যামেরাটি মিউট করে রাখবেন, যাতে হচ্ছে আপনার দ্বারা অন্য কারো ক্লাস উপভোগে কোনো ধরনের সমস্যার সৃষ্টি না হয়। এছাড়াও আমাদের এই আলোচনাটি আপনারা আমাদের বাংলাদেশ হোমিওপ্যাথিক পরিষদের ফেসবুক পেজে লাইভ দেখতে পাবেন এবং পরবর্তীতে আপনারা এই রেকর্ডটি শুনে আবার উপকৃত হতে পারবেন। আর আলোচনাটিটা হবে সম্পূর্ণ ইংরেজিতে। আপনারা আলোচনার শেষের অংশে প্রশ্নোত্তর থাকবে, সেখানে আপনারা প্রশ্নোত্তর বা মন্তব্য বাংলা অথবা ইংরেজিতে করতে পারবেন। আমি স্যারকে ওয়েলকাম জানাচ্ছি। স্যার, প্লিজ কন্টিনিউ ইউর প্রেজেন্টেশন। থ্যাংক ইউ।
Yes, thank you, Dr. Anwar Patwari. Bismillahirrahmanirrahim. Dear viewers, including my brethren, homeopathic practitioners, students, and well-wishers. Assalamu alaikum wa rahmatullahi wa barakatuh. Good evening, Adab. Today, this is the last leg of our previous lecture of case-taking, remedy selection, second prescription. And you can say this is a part of second prescription, Hering's law of cure. Because when you want to make the second prescription, you will have to observe the symptomatic evaluation in the patient according to Hering's law of cure. So unless you know the Hering's law of cure very well, this is difficult to evaluate the action of the patient because we want to cure the patient, not only to palliate. So if you want to cure, you will have to observe Hering's law of cure. Otherwise, you may inadvertently palliate the patient only, not cure. This law of cure, of course, it was described in other way by Samuel Hahnemann, our founders of homeopathic system of medicine, but it was coined in a concrete law of cure by his able follower and students, Dr. Constantine Hering of America, in 1865. It means 22 years after the death of Hahnemann. He coined this law of cure and published it in the homeopathic journals of that time. And since then, it has become a part of homeopathic laws and theories. So let us first see what is there in Hering's law of cure. Then we'll have to explain it scientifically. And if you want to explain it scientifically, you will have to take the help of embryology or embryological evolution of different organs in human body. So this lecture is little bit difficult for those who are less knowledgeable in anatomy, particularly embryology. So we'll have to explain little bit embryology first, then we'll go to law of cure. So let us proceed. This is Dr. Samuel Hahnemann. He described the law of cure in various pages, in various references, but not in a law of cure. This is Dr. Constantine Hering. You see the man, he lived 80 years. He was born in Germany in 1800. And he studied his MD in Germany itself. Then he went to South America in young age. From South America, in 1845, he immigrated to United States of America, then America. and he settled in Pennsylvania state and ultimately settled in Philadelphia. And he was so powerful a man, and he was so knowledgeable, and his personality was so strong that, you see, he was an immigrant to America, but he became the father of American homeopathy. He was regarded as father of American homeopathy. While he died in 1880, homeopathy was already established in a good footing all over America. And he was so revered by the homeopathic practitioner at that time. So let us first tell the law of cure in plain language. I told you that he proclaimed this law of cure in 1865. He died in 1880, so it means 15 years before his death. He said, cures take place with symptoms disappearing from, there are 5 components. Symptoms will disappear from above downwards. The symptom above will go first, then the symptom below will go. This is the way of cure. And the way of disease is the opposite. Disease will start below and go upward. So cure will take place in the opposite way, from above downwards, from inside outwards. First, the disease component will clear itself inside the patient, and it will gradually go to the outer part, superficial part of the patient, then ultimately it will be cured. So from inside outwards, from center to periphery, almost the same thing. The disease starts from center, you see. So cure also starts from center. So center means vital force. First, vital force will be cleared of the disease, say for example, disease effect. Periphery, the more superficial part will be free of disease. Then it is said from more important parts to less important parts or organs. Say for example, heart is an important organ, muscle is less important than heart. Then skin is less important than even muscle. So, movement of the cure will be from more important organs to less important organs or systems. Okay? Then in the last one, in the reverse order of appearance of the symptom. Say, the symptom which appeared in the patient first, this will go first. And which appeared first, this will be the last one to go from the patient. So these 5 components belong to Henry's law of cure. Now the 6th one is added by the later homeopathic stalwarts. They said it can be added that disease should disappear from more destructive miasm to less destructive miasm. It means from syphilis to psychosis, then Sora. Sora will be the last one to disappear from the patient. So this is the law of cure proclaimed by Henry in 1865. Now, if you want to cure a patient, cure, not palliate, you will have to see that your symptoms in your patient follows this line of cure by Henry. From above downwards, from inside outwards, from center to periphery, from more important organs to less important organs, and in the reverse order of appearance of the symptom. Because you see, nowadays, we find very, very difficult patients coming directly or sometimes from the hands of allopaths. Even allopathic doctors failed. Then this patient come to homeopaths. So these are so difficult and multi-organ system affected by the disease. So unless you follow the law of cure by Henry, you can only palliate but you cannot cure. You want to cure, and if the patient is in any way curable, patient may not be curable, then you have nothing to do to cure. But if it is curable, this should follow this law of cure. So let us proceed. Now, you see, this is very important. Disease will move from more important organs to less important organs. Now, how to know in the body, in the human body, which organs are more important, which organs are most important, and which are less important, and which are least important? How to know it? Unless you know, you cannot follow this law of cure by hearing. For that, you will have to know anatomy. And not only anatomy, you will have to know even embryology, because how the systems or organs in the body are developed by God in the human body. During pregnancy, mother womb, and afterwards. You will have to know which organs more important, which organs less important. This is not so easy. And there was a time I was confused. I asked so many of my gurus that what does it mean? I don't understand. How can I know that muscle is more important or bone is more important? How can I know that liver is more important and uterus is less important? How to know? And I asked so many homeopaths and so many gurus while I was young, say before 40 years. And I could not get the answer. But some explain, but not in a good way that I learned afterwards. So this thing I want to share with you. This is very important. And I believe many of our homeopaths, practitioners and teachers, they may not know this thing. So this lecture is really important. I want to share with you. I want to take all this knowledge which I gained during last 45 years of my homeopathic study. So I want to share and give to you who need it. Who knows it already, it's okay for you. So for that, you will have to know the embryology or Bruntottva, embryology, the science of development of human body inside mother and afterwards. Okay? So just I tell you, before going to embryology, that human body develops into 7 different layers. 7 layers from inside to outside, or from outside to inside. 7 different layers. The 7th one is the outermost, and the first one is the innermost. And other things are arranged in between. 7th, 6th, 5th, 4th, 3rd, 2nd, 1st. So you'll have to know it. And you'll have to know also what are the symptoms and functions of each layer. Then only you can understand that which organ has been freed and which organ has been affected. You see? So let us go little slowly, because some of you may not understand. I told you there are 7 germinal layers of an embryo. 7 layers. And please try to follow me. And if you have any confusion after my lecture is over, you can ask me supplementary question, and I will try to make you understand. But still, this is a big lecture. I will skip some portion of the lecture, because I will feel that some of you may not understand in this stage. So I will skip some sections, and I will discuss other sections, so that you know for the first time, and maybe if you get time afterwards, we will discuss the whole one. Okay. So we say that there are 7 germinal layers. Layers mean layers of an embryo from skin to inside. Okay? But we can grossly say that there are 3 main layers in the human body. Human body develops from 3 main layers. The outermost one is called ectoderm, middle one is called mesoderm, and innermost is the endoderm. So you just try to remember these 3 layers. These are the principal layers from which human body develops. The outermost one, ectoderm, from where skin and other things develops. And the innermost is endoderm, from where the various layers of internal organs, internal hollow organs like respiratory system, alimentary system, urinary system, the inner lining of these systems are developed from endoderm. And between ectoderm and endoderm, a big layer is there, a thick layer is there. This is called mesoderm. This mesoderm again divides into 2 sub-layers. One is called mesenchyme, another is called mesothelium. The mesoderm, in between, this one differentiates into 2 more sub-layers. The outer one is mesenchyme, inner one is mesothelium. Okay? Now, before going further, let me explain this 4. Ectoderm, first one is ectoderm. From ectoderm develops our skin and covering of the whole body. Skin, hair, the nail, enamels of teeth, like this. All the coverings of the body develops from ectoderm. Okay? So we know now what is ectoderm and what are the ones developed from ectoderm. Now, if you consider the body like a cylinder, so outer layer is ectoderm, and the innermost layer of the cylinder, the lining, the membrane which lines the inner surface of the hollow organs, this is called endoderm. This endoderm forms different mucous membrane layer of alimentary system, mucous membrane layer of respiratory system, mucous membrane layer of, say, bladder and bile duct, mucous membrane layer of urinary system, mucous membrane layer of, uterus and vagina, like this. All hollow organs, their inner lining develops from endoderm. So now we know what are the organs developed from endoderm. Now between ectoderm and endoderm, it's a big, thick layer. I told you this is called mesoderm. This mesoderm, again I say, it divides into 2 sub-layers. The outer one is called mesenchyme. Inner one, mesothelium. From mesenchyme, what develops? From mesenchyme develops all the connective tissue like muscles, bones, dermis, various tendon, aponeurosis, blood, lymphatics, and all these things. Those connective tissues, muscles, bones, blood, lymphatics, and say tendons, cartilage, all these things. These develop from the mesenchyme. Mesenchyme is the 3rd layer. And inner layer is mesothelium. From mesothelium, all the vital organs inside the body, liver, lungs, heart, then the kidney, spleen, these develop from mesothelium. So I hope you now understand these 4 layers because these are easier. Ectoderm, then mesenchyme of mesoderm, then mesothelium of mesoderm, then endoderm. These 4 layers from outside to inside. Okay? Now let us go to other 3 layers. If you understand these 4 layers, other 3 are easy. Okay. Now what is the 5th layer? I told you 7 germinal layers. Here 4 layers. Ectoderm, then mesenchyme, mesothelium, and endoderm. Now let us come to 5th layer. You see, this is called here. This is neuroendocrine glands, specialized cells. All our hormonal systems, endocrine glands. I will tell you afterwards what are the organs. Like say for example, our hypothalamus, pituitary gland, thyroid gland, then ovary, then testes, then pancreas. These are the endocrine glands. This is called neuroendocrine glands. This is the 5th layer. Now I'll have to explain to you why it is 5th layer and what is the composition of the glands. You see, this endocrine gland, like say for example, thyroid gland. Thyroid gland has a structure, connective tissue structure. And there are specialized cells from where hormones are produced. Now, this connective tissue framework of the endocrine gland develops from ectoderm, endoderm, and mesoderm in a mixture of all these 3. In a mixture of ectoderm, endoderm, mesoderm, they make the mesh or structure of the organ. And the hormonal cells from where hormones produced, they come from it is called neuroectodermal layer. Means the nervous system, brain, then the spinal cord, the sympathetic, parasympathetic glands. From these neural structures, nerve structure, like brain and spinal cord, this specialized cell comes and they are lodged in the framework of the endocrine gland. So endocrine gland contains specialized cells which produce hormone, and these cells come from neuroectoderm. This is called neuroectoderm. Okay? This is a little bit difficult for you. Only you try to know that 5th layer is endocrine glands. Pass. 5th layer contains all endocrine glands. Now let us come to the 6th layer. 6th layer is developed from neuroectoderm. What is neuroectoderm? We'll discuss afterwards. These are the nervous system itself. Your brain and spinal cord, sympathetic, parasympathetic organs like this, and all the nerves. The central nervous system means brain and spinal cord, and peripheral nervous system means all the peripheral nerves, including sympathetic and parasympathetic. All these neural structures form the 6th layer, from the 6th germinal layer. So up to this 6th, let us enumerate again. First layer was ectoderm, second layer was mesoderm and its component mesenchyme. Third layer was mesothelium of mesoderm. Then 5th layer is endocrine glands. Okay. 6th layer is neuroectoderm. Okay. Now let us come to the 7th layer. What is 7th layer? 7th layer is the genetic code inside the cells. It means the chromosomes which contains the code of functions of all the cells and body. this chromosome contains components which controls all your body. It dictates that this man will be tall or short. This man will be fat or thin. This man will have diabetes. This man will have cancer. These are coded in the genetic code of the cells like chromosomes. So these chromosomes inside the cells, the seventh layer. This is the innermost. And you see, this controls the whole body. And this dictates what the body will function. His respiration will be how his respiration will be. You will have what respiratory action. This will be dictated from the chromosomal components. So this is seventh layer. I'm not going to, okay, I can say more. This seventh layer again has two sub-layers. One is called basic code, another is called inherited code. Basic code means the chromosome has components which controls the normal functions of the body, like how his respiration, his digestion, how his urination, how his sex life. These are the basic functions controlled by the hormone, by the chromosome. And there are some inherited code, comes from the parents. These dictate how this guy will develop. He will be tall like his father, or he will be short like his mother, or he will have diabetes like his mother. You will have blood pressure, hypertension like his father. These are inherited from his parents. So all these code, basic code and inherited code, belong to genetic code of the cell, means chromosome. So chromosome is the seventh layer and the innermost aspect of the body. So if you understand this seven layer now, this will be very easy to discuss hearing low flow. So the first layer is again the first layer is ectoderm, second layer is endoderm, third layer is mesoderm. Mesoderm has two sub-layers, mesenchyme and mesothelium. Then fifth layer is neuroendocrine, means endocrine glands producing hormones. Sixth layer is brain and nervous system. And seventh layer is chromosome inside the cell. Okay. Now let us see or let us discuss little bit of embryology. Those who know embryology already, okay, for you. But those who do not know, just try to understand. I will try to explain it in a very easy way. So let us come here. We start embryology from here, okay? How an embryo forms inside mother's womb, you see, after copulation of husband and wife, the sperms goes from husband to mother's womb, mother's uterus. And you know how many sperms? In each ejaculation, there are 4 to 6 ml of average, 4 to 6 ml of semen. And each ml of semen contains minimum 40 million, means 4 crores of sperms. So if it is 6 ml, it contains 2 crores 40 lakhs. No. What will be 4 crore? 24 crores of sperms are ejected from husband to wife's home. And all these go inside the uterus, then go towards say, fallopian tube, both sides, and they're trying to find out the ovum which has been ovulated from the ovary. There is only one ovum, and there are 24 crores of sperm going to win one ovum. So if one sperm can fertilize, can penetrate the ovum, so this is called fertilization. But goes inside the ovum, and this is called fertilization. And then the embryo starts from here. This embryo, this will travel through the whole fallopian tube, like this, like this, like this, to the uterus. And this will take more than 1 week, say 9 days. After fertilization, this fertilized ovum will travel all through the fallopian tube, and it will go to the bottom of the uterus and implant there by 9th day. Then this will start growing. This embryo will grow. From 1 cell, it will be 2 cell, then 8 cell, then 16 cell. Then there will be a mass of cell like this. Let us see. Like here. First it was, you see, 1 cell. Then there are, say, about 8 cells, then more, then more. Then ultimately there will be a group of cells, and there will be water. There will be liquid, you see. Then there will be 2 layer and 2 cavity. I'm not going to tell you this name to confuse you. Just see. Then this will grow, grow, and ultimately this will make a bread-like structure, roti, bread-like structure of 3 layers. Say, as if this is a sandwich of 3 breads. This is a bread, round bread of 3 layers. Here, let us see. Let us see. This will be like this. This will be like a bread, but this contains 3 layers. How these 3 layers come here? You see, first layer is ectoderm. This is called ectoderm. And inside there is enteroderm. You see, enteroderm. And in between ectoderm and enteroderm, there is some cells migrate there, and they form another layer. You see, it comes here. Now there are 3 layers. This is called ectoderm. Inside there is enteroderm, and in between there is mesoderm. And I said you, mesoderm again divides into 2 layers. You see this one. This is mesenchyme, and this is mesothelium. So there are 4 layers: ectoderm, mesenchyme, then mesothelium, then enteroderm. Now you found the 4 layers here: ectoderm, and mesoderm, and enteroderm. And again, mesoderm has 2 layers. This is mesenchyme, then this is mesothelium. Okay. So it becomes like this. If you can understand here also, you see, it is a cross section. So it becomes, you see, this is the brood, this is the embryo, this is the head portion, this is the leg portion, and there are 2 cavity. This is amniotic cavity. This is called amniotic cavity. Inside, the baby hangs inside this liquid of these 2 cavities. Okay. Then this one will develop into an embryo like this. It will develop like an embryo here like this one. So this embryo has, from outside to inside, there is ectoderm, then mesoderm has 2 layers, mesenchyme and mesothelium, and inside there is enteroderm. Like here you see, if you cut it, this will be like this. Inside there will be cavity. This cavity is lined by, this is endoderm. This one is mesoderm, this is ectoderm. So, this is the baby. That's here, you see, embryo in early stage all become similar in structure. It is fish embryo. This is a reptile, like crocodile, say for example. This is a bird embryo, and this is a human embryo. Do you see? Bird embryo, human embryo, reptile embryo, almost same, almost same. Here you see, this is at 8th week, 2 months of age. Then 3 months, 4 months, 5 months, 6 months, 7 months, 8 months, 9 months, and this is 40th week. The baby will be born. You see? So here, he will live in mother's womb like this. His head will be below and breech, this is called breech, will be above. And during delivery, this head will come, this is the cervix will dilate, and this will come toward the dilated cervix and vagina outside like this here. I hope during your study in DHMS and your BHMS, if there is someone having BHMS degree, you learn these obstetrics, and I hope you also know the term, because obstetrics and gynecology belongs to homeopathic practice, at least 20 to 25% case. When a woman comes to you, she may come with her normal diseases like men, so like cough, like a peptic ulcer, like constipation, or she may come with female diseases. So you'll have to know gynecological diseases and obstetrical conditions also as well. So I am not going to go in detail, but I'm interested in this subject because before 43 years, I was working in this department, registered in the Department of Obstetrics and Gynecology of Rajshahi Medical College Hospital, and my duty was that time to deliver the woman, pregnant woman. So many deliveries, normal delivery, forceps delivery, venous delivery, cesarean section, all this I used to do that time. So this is very interesting subject, and every homeopath should know at least the major problem of obstetrics and gynecology. Now let us skin has two, and inside epidermis there is another deeper layer. This is called dermis. So from ectoderm only epidermis develops, not dermis. Dermis from another layer, I will say afterwards. So skin, epidermis of the skin develops from ectoderm. Then epithelium of the cornea, conjunctiva and iris. In the eye, there is no cornea, there is conjunctiva and iris. This thing develops from ectoderm. The lens of the eye, this lens where cataract develops, this also develops from the ectoderm. Then here, I don't have here. You have here. This here develops from ectoderm, but not all the parts. Only the hair. There is hair follicle. When you pull a hair, you find there is something comes inside from inside the skin. This is called follicle. Follicle develops from another layer. You see? So only the hair outside the follicle, this hair, which one you see, this develops from ectoderm. Then nails, your nails develop from ectoderm. Then enamel of teeth, not the whole teeth. Only the outside enamel of teeth develops from ectoderm. Then you come to the ear. In the ear, the external auditory canal, this ear canal up to the tympanic membrane, ear membrane, develops from ectoderm. Then lower part of the anal canal, you know anal canal, by what? Not the whole anal canal, the lower part of the anal canal develops from ectoderm. The terminal part of the urethra, utronali. Lower part of the urethra also develops from ectoderm. Then lower part of the vagina also develops from ectoderm. Lower part, not whole part. Then lips, these lips, cheeks, gums, and outer part of tonsils. So you will have to keep in your mind or in memory that what are the organs developed from ectoderm. To know the movement of cure according to Henry's law of cure. So these are the structure developed from first layer, ectoderm. Now let us come to the second layer. Which one second layer is? Entoderm. This is the ectoderm is the outermost covering, okay? And entoderm is the innermost lining of all the whole organs like stomach and colon, urethra, and like this, all these things. So this portion I am not discussing. This is a little bit tough. Maybe afterwards we will discuss. Now today only the parts which develop from various layers we will discuss. And then afterwards we will see the movement of disease from various layers. So this is the entoderm. From entoderm what develops, you see? The respiratory tract epithelium from nose up to the alveolus of the lung. All this lining develops from the respiratory tract. So say for example bronchial asthma. Bronchial asthma is a disease of second layer. This is a disease of respiratory tract epithelium. Then gastrointestinal tract, alimentary tract epithelium. So, say for example, gastritis, peptic ulcer. This is a disease of second layer, entoderm. Urinary tract epithelium. So we say urinary tract infection, urethritis, cystitis. So these are the disease belonging to second layer, entoderm. Epithelium of gallbladder, extrahepatic duct. Also, they belong to entoderm. Okay. Now let us come to ectoderm and innermost lining entoderm. Entoderm is the second layer. Now let us come to third layer. Third layer derives from mesoderm. I told you mesoderm divides into two layers, mesenchyme or mesenchymal tissue and mesothelium. So mesenchyme is the third layer. From mesenchyme, what are the structure develops? Let us know. Now before going to that, I tell you, mesenchyme is divided into three layers or three components. One is called dermatome, another is myotome, another is sclerotome. From dermatome, dermis of the skin develops. I told you while we discuss ectoderm. There's skin has two layers, epidermis and dermis. So from ectoderm only epidermis develops, and the dermis develops from third layer. You see, from third layer, mesenchyme. Then it is called dermatome. Then myotome. Myotome gives rise to muscles. All the muscles of the body, all muscles develops from third layer, mesenchymal tissue myotome. Then sclerotome. This gives rise to bones and cartilage. So bone and cartilage also develop from third layer. So now you are knowledgeable. You know everything. And along with these bones and muscles, all fascia, tendons, aponeurosis, bursa, and blood and lymphatics, all our blood inside the body. Blood develops from third layer. So blood disease belongs to third layer. So if you know the structure developed from each layer, then you know the disease develops from which layer. So the mesenchyme differentiates to three layer: dermatome giving rise to dermis, myotome giving rise to muscles, sclerotome giving rise to bones and cartilage. So third layer gone. Now let us come to fourth layer. Fourth layer. Fourth layer, I told you, this develops from mesoderm, and the component is called mesothelium. This is mesothelium. This mesothelium produces all the parenchyma of vital organs. Parenchyma means the structure, the framework of lungs, framework of kidney, framework of heart, framework of liver, spleen, like this. All the vital organs framework develops from, or the vital organs develops from mesothelium. So kidney develops from mesothelium. So if there is nephritis, kidney failure, this is the disease of fourth layer. Lung parenchyma, you see, if there is tumor in the lungs, this belongs to fourth layer. If there is hypertension, heart failure, hypertrophy of the heart, then say valvular heart disease, all these belong to fourth layer. So you know that now, disease belonging to fourth layer. Okay? Now let us go to fifth layer. Fifth layer, I told you, all the endocrine glands develop from fifth layer. And the endocrine gland structure develops from elsewhere. Only the cells, specialized cells which produces hormones, they come from neuroectoderm. Anyway, just you know that all the endocrine glands belong to fifth layer. What are the endocrine glands? You know, first one is hypothalamus, just below our brain. And below hypothalamus there is pituitary gland. And here, you know, thyroid gland. Behind thyroid there is parathyroid gland. And above kidneys there is adrenal gland. And behind stomach there is pancreas. Then female has ovaries, male has testes. All these are endocrine glands. And there are some specialized cells. These are called AUPD system. I will not discuss it because it will be confused. Just you know that fifth layer develops also some special cells. Like, for example, we know that there is leukoderma develops in our skin. Leukoderma, Sheti. Why? Because in skin there are some specialized cells. This is called melanoblasts. They develop this special color of the skin. So when these menoblast cells fails or stops making this coloring agent, you find there is leukoderma. So these melanoblast cells, these are special cells. This also develops from fifth layer. Just you keep in your mind. The melanoblast in the skin, in the dermis, they comes from fifth layer. So if there is a patient of leukoderma, it belongs to fifth layer problem. It belongs to fifth layer pathology, this leukoderma, because the melanoblast cells belongs to fifth layer, special cells. I hope you understand up to this. Next we come sixth layer. This is a little bit easy. Sixth layer contains all the nervous system. Nervous system we can divide into two: central nervous system and peripheral nervous system. Central nervous system contains our brain and circuit. Peripheral nervous system contains all these peripheral nerves and sympathetic and parasympathetic nerves. So all nerves and brain and spinal cord develop from sixth layer, belongs to sixth layer. So if you find a patient of Parkinson's disease, or say some tumor in the brain, meningitis, any problem belongs to brain, spinal cord, and their meninges and nerves, they belong to sixth layer pathology. Okay? Like you see, neurofibromatosis, then disseminated sclerosis, Parkinson's disease, any neuritis, peripheral neuropathy, all these belong to sixth layer pathology. Now let us go to seventh layer. I told you in the seventh layer contains chromosomal abnormality inside the cell. Chromosomal abnormality. And there are two types of components. One is called basic code, another is called hereditary or acquired code. Basic code contains instruction for performing normal functions of all the organs. And hereditary code dictates about the character of this particular person, whether he will be tall, he will be short, he will be fat or thin, he will have baldness like me at the age of 50, or there will be this is called graying of the hair prematurely, or he will have psoriasis, he will have some diabetes. These are dictated by the hereditary code of the chromosomes. So, all hereditary disease belongs to seventh layer. Seventh layer. So, if somebody has hemophilia, somebody has epilepsy, hereditary epilepsy. These are all seventh layer disease. So now we try to understand or to enumerate the seven layer of the human body, seven germinal layer. First, second, third, fourth, fifth, sixth, seventh. First one is ectoderm, second one is endoderm, third one is mesenchyme, fourth one is mesothelium, fifth one is endocrine gland, sixth one is brain and spinal cord, and seventh one is chromosomal disorder, chromosomal component of the cell. Okay? Now, at least by now you know the different layers or different organs of the human body and their relative position to one another. Which one is outside, which one is inside. Now you can easily say muscular disease is more superficial than lung disease, bony disease, if there is arthritis. Bony disease is more superficial than heart disease, because heart belongs to fourth layer and arthritis belongs to third layer. Now, if you have understood this thing, Now we will make an exercise. That whether you understood this thing, and you can understand from the patient symptomatology, then his cure is going or following the any slow of cure or not. One patient came to you, so for example, he has arthritis, rheumatoid arthritis. You selected his medicines. For example, this is Costicum. You gave him Costicum 1M, okay? Then after 1 month he came and he says, Doctor, my arthritis is better, much better now. But before I had no headache, now I am having severe headache. Or he may say that before there was no itching in my body, but now you see I have itching. So now you will have to corroborate from arthritis to itching, arthritis to headache. So whether it is following headache slow of cure or not, from which layer to which layer. If you can understand, you will learn it very well. And this will help you too much in your practice. So let us come to the practice. Now to evaluate this movement of symptoms from layer to layer, you will have to know one thing, that after your medicine, patient himself, the inside of the patient, Vitulka says energy, and we say self, well-being. This should be better. Patient should say that after your medicine, I am feeling better, not my joint is feeling better. I am feeling better. Now I am sleeping well, better than before. I have appetite. I find energy in my body. This is very important. Rather than your symptom, say, evaluation. Okay? After this one, then you see his symptom, how it is following. So we'll have to think that after my medicine, if my medicine is a similimum and it is following the Hering's law of cure, that patient himself must feel better. Then I'll see the movement of symptoms. And movement of symptoms, I'll consider according to 7 layers of germination. Now I give you the example. One patient came to you with peptic ulcer. He said, Doctor, I have acidity. Always I have sour erection, and after I take food, I have bloating, and I feel very bad. And I take omeprazole, Sargel, this and that. Every day I'll have to take. I feel very bad. So this is a case of say, hyperacidity or peptic ulcer or something you say. Now you took the history nicely, because you will have to give him medicine not according to the name of his disease but by his totality of symptoms. Now, by totality of symptoms, we found that yes, his medicine is, say for example, phosphorus. Why phosphorus? Say for example, the patient was told, patient is cold sensitive, and patient said, oh, when I feel pain, I take very cold water. If I take ice cold water, I feel much better. Something like this. And when it becomes warm, it becomes vomiting. And from other symptoms, okay, you selected his medicine to be phosphorus. You gave him 1M. Or if it is 50 millisecond potency, say you gave M1 or M2, daily 1 dose, something like this. Now after 1 month he came to you. He said, oh doctor, thank you very, very much. I had a very bad acidity in my stomach. Alhamdulillah, this is now much better. But he said with a comment that, but nowadays I find my hands and feet becomes numb. There is numbness, tingling, jinjin kore, haat pe jinjin kore. There is tingling. It was never before. Now, how will think? That your medicine acted well, it acted according to Herring's law of cure or not. You'll have to now see how. So first you will have to evaluate that his stomach problem, this acidity, this peptic ulcer, it belongs to which layer? It is which layer disease? I hope some of you can answer. It belongs to second layer because this is enterodermal. Stomach layer is enteroderm and acidity is there. So this is second layer disease. Now numbness means tingling, numbness, nerve belonging to nerves. There is peripheral neuropathy, something like this. So nerves belong to sixth layer. Now we'll have to think. But after your medicine, the disease has traveled from second layer to sixth layer. Second layer is more superficial. Sixth layer is more inside. So instead of going inside outwards, it has got the opposite way, from outside to inside. So though he said that I am feeling better, this is a wrong prescription. And it will not cure him. This will give only palliation. Because it followed wrong direction. So you see how you apply Henry's law of cure. Okay, second example. Same patient. He said, oh doctor, fine, thank you very much. By your medicine, I am feeling much better of my stomach pain. But there is one thing he added, that my ankle had never ever any pain. But nowadays I find my ankle is paining. I cannot wear shoes. So he was happy for his gastric pain, but he added this thing. But as a doctor, you'll have to now consider whether your medicine's action followed Herring's law of cure or not. So, as I said, your peptic ulcer or your gastric pain or acidity belongs to second layer. An ankle joint, it belongs to mesenchyme, third layer, connective tissue. It is joint, you understand? It belongs to third layer. So your disease shifted from second layer to inner layer, third layer. So this is against Herring's law of cure. It should go from second to first skin, but it has gone instead of first, it has gone inside, inner layer, third layer. So this is a wrong prescription. Though it has palliated the patient. Now third example. A patient came to you, he said, doctor, I visited several gastroenterologists, very famous gastroenterologists, and they did colonoscopy, endoscopy, and all this thing, and they said, I have this is called IBS. What is this? Irritable bowel syndrome. And they were giving me medicine. I feel a little better. Then again it comes. I go to another gastroenterologist. Again he makes this same colonoscopy and endoscopy, and he gives some other medicine. I feel better. Then again I have worse. I go to another one. Like that, I am now tired. So I have come to you. I heard that homeopathy will not palliate, it will cure. So please treat me well. You have taken his history very nicely, okay? And you found that he has, in your suggestion, this is, say for example, argentum nitricum. Why argentum nitricum? Maybe you found that he has bloating. Always, he takes some food, he becomes flatulent, and there is diarrhea. And he likes very much sweet food, and he takes sweet and he gets diarrhea. And again, he is very shaky man. He has much anticipation. He goes to any interview anywhere, and he feels urging to stool. by the stress of the examination, or you find that he's a restless man. So we consider all the totality of symptoms. You selected argentum nitricum, okay, and you give him, if you are a centesimal prescriber, say 1 m, maybe 200 or 10 m as you like, and if you are like me, the 6th edition LM potency prescriber, so I will give him say M1 or M2 argentum nitricum, okay, M2, M3, M4, okay. Take every day from cup and come after one month. So after 1 month he came to me, okay, and he was very happy. He said, "Doctor, I just wasted my time and money going to many allopathic gastroenterologists, but you are the good one, best one." So by your medicine, you see, now I have no IBS. I pass only once a time, once a day stool, and alhamdulillah, I have no flatulence. But there is some problem. What is the problem? He will show you his leg. Then he found that there are some eruption appear. Now you'll have to know what type of eruption. Then you diagnose this is psoriatic eruption. Psoriatic eruption, not scabies, psoriatic eruption. Now, how can you evaluate your prescription? So diarrhea belongs to second layer, because this belongs to mucous membrane of the gut, of the alimentary tract. So IBS belongs to second layer. And psoriasis belongs to third layer. Why? Because psoriasis does not affect epidermis, it affects dermis, mesodermal. So dermis belongs to third layer. If it was scabies, then it was nice. Scabies belongs to epidermis, means first layer. But here it is psoriatic. So it means from second layer it has got to third layer. So this is wrong prescription. But if the patient said that I had some allergic eruption or I have some scabies-like eruption, then it was correct. It was right prescription. But if it is psoriasis, it is wrong prescription. Second example, same patient. Instead of his IBS was very well by your argentum nitricum, but he said, "Doctor, I never had any white spot in my body. But after your medicine, you see, I find here there are 2 white spots appeared in my body. Means he had 2 leukoderma spots, vitiligo spot." Now how can you evaluate this case? His IBS belongs to second layer, and vitiligo, leukoderma belongs to 5th layer. I told you, 5th layer, melanoblast. That time I told you, melanoblast. Melanoblast belong to 5th layer. These are special cells. So his disease moved from second layer to 5th layer, more inside. It means it is wrong direction, not following the Herring's law of cure. Your medicine only palliated him, it will not cure. Okay? Or next example, same patient, for example, not vitiligo. He said, "Oh doctor, thank you very much. My IBS is much better now. Hurrah." I find that I am losing my hair. There is too much hair fall started after the medicine. Oh. He's happy for his IBS, but he's unhappy that he said, "I had little hair and these are falling every day." Now what will be your evaluation? You know that IBS belongs to second layer, and hair fall, I told you, hair has 2 components. The outer component belongs to first layer, ectodermis. Its base The hair follicle, it belongs to third layer, mesoderm. It belongs to third layer, mesoderm. It means if there is hair fall, the disease has gone from second layer to third layer. So this is wrong direction again, wrong direction. You understand the thing? But if you say that after your medicine, I have good stomach, no IBS, but I find that my hair is grey. চুল পেকে যাচ্ছে, hair is grey. Then this is correct. This is right direction. Why? Because IBS belongs to second layer. And চুল পাকা, graying of hair belongs to first layer. Because hair belongs to first layer. Hair follicle belongs to third layer, but hair belongs to first layer. So if there is graying of hair after your medicine, this is correct. But hair fall, not correct. Okay? Now another example. I'm going to finish very soon. He said, Doctor, after IBS is good now, but I have itching eruption. You see, so much eruption I have. Not psoriasis. It is itching eruption. Then this is the right direction because itching eruption belongs to ectoderm. So his disease shifted from second layer to first layer, more outer layer. So this is the right direction. It is following Herring law of cure and your excision is correct. The last component, sorry. A patient of bronchial asthma came to you, Apani, bronchial asthma. He said, Doctor, this is in my childhood. My father had bronchial asthma as well, and I am suffering too much. I am taking 2 inhalers, and sometimes I am taking this is called, I forgot. I am using inhaler, okay? And so many medicines. And still I feel very bad. So I heard that homeopathy can cure bronchial asthma and I came to you. So it is telling the case. You took the case very well. He had bronchial asthma. He said that I find it is worse at night. When I go to sleep, it's okay. But I get up 3 to 4 o'clock. That time, it becomes bad. And I have to get up and I have to bend forwards. Then I feel better. And he is cold patient. He has flatulence. He has pain in the back. He has too much sweat. So considering all these totally the symptoms, what medicine will give him? He will give, say for example, Kelly Carb. And you said that I gave you a very good medicine. Use it as I instructed you. It came after 1 month. It's very, very easy. Oh, doctor, after a long time, I can sleep without inhaler. I can sleep without nebulizer. Oh, doctor, you are a very good doctor. But I find lately my blood pressure was okay. That time I had some headache and I checked my blood pressure. Oh my God, this is now very high. I went to doctor. He said that my blood pressure is high and I may take tablet for blood pressure. So please help me. So how can we evaluate during his second prescription? Any law of cure? Bronchial asthma belongs to what? Bronchial asthma belongs to second layer because this is in the respiratory mucous membrane of the bronchial tube. Bronchial asthma. So this is second layer disease. Blood pressure belongs to fourth layer, heart and blood vessels. These are fourth layer organs. So you have pushed the disease from second layer to more inside fourth layer. So though his asthma is temporarily better, this is a wrong precision because this gave heading low cure a wrong direction. So this is not cure, it is only suppression or appellation. Okay, another example. He said, not blood pressure, that my bronchial asthma is much better, but I have pain in my neck, too much pain, and pain from neck, it goes to my hand and there is numbness like this. So I went to orthopedic doctor, he made a CT scan and he said I have cervical spondylitis. I have on both sides there is some erosion or degeneration. And neck pain developed after bronchial asthma getting better. I will think your bronchial asthma belongs to second layer and cervical spondylitis belongs to third layer, mesenchyme. And also you see bronchial asthma is below and neck is above. So according to headache low cure, disease should be cured from above downward. But this is from below upwards. So there are two mistakes. One is from second layer to third layer. Disease has shifted again from below upward. So this is a wrong prescription. Okay. Now maybe the last one. A patient of lumbago sciatica came to you. He said, for a long time, I'm having this back pain, and this pain going to my right lower limb, from back to right lower limb. And I have too much pain. And I went to orthopedic doctor. He said that give me injection, and if it does not help, maybe I will lead him to you. Okay. If his head was off, say for example, like a shish, because again his back is slightly like this is, you know, it has an exception. It is left-sided, but on the sciatica and on the back, it takes the right side. And you find other symptoms of leakage also. He cannot tolerate any constriction here, and his temper is very high, and he has a fear of snake. So, considering all these totality of symptoms, he selected medicine leakages. So you have given, say, if it is 50 millisieverts potency, you give M1 or M2, before take 1 day or maybe every other day, diluting in a cup, or if it is centesimal, you give him 1M and give him placebo for 1 month and tell him come after 1 month. He came after 1 month and he was very happy. He said, "Oh doctor, this is very nice. Now I can walk and I can sit long time without any pain. And I had before also numbness in my leg due to this sciatica. All these are good. But I find I had chest pain. Or he may say chest pain with palpitation. Oh. And he said, I went to one cardiologist. He did one ECG and he said there is some anginal pain. Not heart attack, but anginal pain. There is some tension. So how can you think? How can you evaluate your case? Lumbago-sciatica belongs to third layer, mesenteric. And angina pain belongs to fourth layer, heart, fourth layer. So it is wrong direction. Same thing if he says not angina pain, he may say that my blood pressure is high, then also it is from third to fourth layer. This is wrong prescription. I think this was today, or okay, just I give you one more. This is the last one. Patient said this same lumbago-sciatica patient. Patient said my back pain is much better, but I find my blood sugar is more now. It's okay before, always 7, but this time it is 12. My blood sugar rises. So how can you evaluate your lumbago-sciatica belongs to third layer, and blood sugar means he has deficiency of insulin. So it belongs to fifth layer, endocrine glands. So this is wrong direction. From third layer, it has gone to fifth layer. So this is a wrong prescription. So you see, how can you apply any slow of cure in your practice, and you can take correct direction of cure, and you can change your medicine, because you will have to know that your medicine is palliating only, not following the path of law of cure of herring. So this is a big subject. I try as short as possible. I hope that if some of you did not understand all, but at least you understood little bit, still it will help you in your practice. And at least it will excite your interest to know any slow cure better than before. And you'll have to read it again. And if you understand any slow cure, you'll be a good practitioner. You can cure complicated diseases, chronic diseases better than before. So this was today. I am finishing it. Thank you very much for patient hearing. Assalamu alaikum wa rahmatullah wa ma tawfiq illa billah. Dr. Anwar Patwari, I am to you. You can take some question because it is already 11 o'clock, and some commentary. Thank you very much.
থ্যাংক ইউ বলবো। প্রশ্ন অথবা মন্তব্য নেব আমরা। প্রায় 11টা বেজে গেছে, বেশি নেব না। ডাক্তার ফায়েজ রিফাত, আপনার প্রশ্ন পাচ্ছি। হ্যালো, আপনার একটু জোরে বলবেন। হ্যালো, হ্যালো, আমরা শুনতে পাচ্ছি, তবে স্পষ্ট না।
আচ্ছা স্যার,
জি জি, এখন বলুন প্লিজ।
জি, থ্যাংক ইউ স্যার, এত গুরুত্বপূর্ণ একটা লেকচারের জন্য। স্যার স্যার আমি একটা প্রশ্ন করতে চাই স্যার, একটা জিনিস জানার জন্য। স্যার 50 মিলিসিমেল ওষুধের সোর্স কোথায়, বাংলাদেশে কি পাওয়া যায় স্যার?
50 মিলিসিমেল ওষুধ বেস্ট ওষুধ। 50 মিলিসিমেল ওষুধ বাংলাদেশে না, শুধু ইন্ডিয়াতে না, শুধু সারা পৃথিবীতে বেস্ট।
জি স্যার।
বিলংস টু হেপকো, Kolkata Animal Publishing Company medicine. This is the best 50 millisimial medicine in the world. It is available in Dhaka. You can collect from here. Thank you.
Yes, thank you, sir.
কোনো প্রশ্ন বা মন্তব্য থাকলে হ্যান্ড রেজ করলে নামটা ঘোষণা করব।
I think there is Dr. Sheikh forward and give your valuable commentaries about the topics. Professor Dr. Shibli Ahmad Shibli, Professor of Community Medicine, Sylhet Usmani Medical College. তোমার দেখা যাচ্ছে না কেন? ছবি দেখা যাচ্ছে না।
So Faruque bhai, so like all the time, it's very useful, and I am very much amazed that you blended hearing law with the embryology. Very difficult. So, but it's very unique. I can say another way. It's very, very unique. What you have said. I am thinking, so I need to do some research as well as some deep thinking and reading. Very useful, Faruque, very useful, I see. And it's this lecture is some, I can say, it's gone to some higher level. Not many people, so without the knowledge of embryology, as well as some deep knowledge in homeopathy. So it's difficult to understand it. It's really difficult, but it's so useful in clinical practice, so useful. It's something very new. You have shed new light in the homeopathy practice. And I will be making some comment afterwards, not now, because I need to understand it more. I need to study it more. It's very useful. I think it's very, very useful. Lot many people will be benefited. And we are very lucky that we have got you and the lecture that you have delivered. I have this lecture once in Sylhet, so not this much elaborate, but once you talked about it in a program in Sylhet, I can remember it. And I have a copy of that, and that lecture you gave it. So I have a copy of it. And I've gone through it. And again today, it's difficult. It's somehow difficult. So anyway, it's what I say, my comment is that it's very useful. It's very useful. And if we can get some sorts of new kind of thinking, and if you can give this lecture to some international forum, that could be more useful. People could be more interested. You will get many people more interested, new things, new light in homeopathy. So I will be making comment afterwards what I have said. Thank you very much. Thank you. We have so it's very painstaking. যা আপনি এইটা লেকচারটা আজকে আপনি এটা দিয়েছেন, এখানে আমি জানি যে এটাতে আপনার কত কষ্ট হয়েছে এবং আপনি কিভাবে এটা রেডি করেছেন, এবং ইউ হ্যাভ এটা হচ্ছে ঠিক গাড়ির পার্টসের মতো, যে মানে ইউ হ্যাভ এস্টিমেটেড ইট। Lucky, very lucky. So thank you, Faruque bhai. Thank you so much.
Welcome, Shibli, because I am sure you are one of the few who understood the, and I think we can of our homeopaths, I believe they are serious. Discuss afterwards also. So practitioners, there are many serious practitioners. They should understand hearing law pure well. Otherwise, they can take good cases. Okay, thank you.
Thank you very much, Dr. Shibli Ahmed sir. Dr. নাসির সরকার, আপনার হ্যান্ড রাইজ করেছেন, মাইকটি আনমিউট করে প্রশ্ন বা মন্তব্যটি করবেন। ডক্টর নাসির সরকার, শুনতে পাচ্ছেন নিশ্চয়ই? আপনার মাইকটি আনমিউট করে প্রশ্ন বা মন্তব্যটি করবেন। আচ্ছা, ডক্টর হেদায়েত, আপনার মাইকটি আনমিউট করবেন প্লিজ।
Yeah, assalamu alaikum, sir. It was again a great lecture from you. the day by day, like, granted your lecture by going to the high level was Mr. Dr. Sabir told also us. Obviously, like, these very interesting things to know also, like the embryology, when you show the fish, bird, and the human, more or less are similar, it's going from the embryology and then go up bigger, and then obviously human big body gets bigger, etc. It is not completed today, right?
No, no, because I briefed the lecture. So because if I elaborate the lecture too much, I was afraid that maybe many may not understand it. And
Yes,
also this is an English lecture. That's why I briefed the whole subject so that the main message I can give. So I hope this will be last today, because I will elaborate in another forum. If I think that there are interested person who want to know it elaborately, we can give another chance in another forum. Because now this is a big lecture I gave, from case taking up to Phoenix of Noor. I want to finish it, and because there are other homeopaths who are pressing me that you give only English lecture, why not starting the Bengali one? That's why maybe next lecture we'll start in Bengali.
Okay,
And
sir.
this is the finish. Okay, thank you very much.
Okay, no problem. Thank you, sir. Assalamu alaikum.
থ্যাংক ইউ ভেরি মাচ স্যার। আর স্যার, যদি কোনো মেসেজ থাকে, আমরা আর কোনো মন্তব্য বোধহয় না নিলেই হয়। আপনার যদি কোনো প্রিভিয়াস আমাদের সামনের সাংগঠনিক বা কোনো মেসেজ ক্লাস সংক্রান্ত বিষয় যদি থাকে, সেটা দিয়ে আমরা আজকের মতো শেষ করতে পারবো স্যার।
আমি এখানে যারা আছে একটু ফোর মেসেজ দিতে চাই যে আমরা হোমিওপ্যাথিক বাংলাদেশ হোমিওপ্যাথিক পরিষদ, আপনারা জানেন 2022 সালের জুলাই মাসে আমাদের নতুন কমিটির দায়িত্ব দিয়েছিল, এবং আমাকে সর্বসম্মতিক্রমে কেন্দ্রীয় কমিটির প্রেসিডেন্ট নির্বাচিত করা হয়েছিল। তো আমাদের টার্ম ফিনিশ হয়ে যাবে সামনের জুলাই মাসে। তো আমরা জুলাই মাসে আবার সম্মেলন করে নতুন কমিটি আমরা গঠন করব। এই জন্য আমি আহ্বান জানাবো, যারা হোমিওপ্যাথিক পরিষদের সদস্য হন নাই, অথচ হোমিওপ্যাথিক পরিষদে কাজ করতে চান, তথা এই দেশের হোমিওপ্যাথিকে আরো আপনি সার্ভ করতে চান, আপনারা এই 2-1 মাসের মধ্যে আমাদের মেম্বার হয়ে যান, আমাদের সদস্য পদ নেন। এবং আমি আপনাদের আহ্বান জানাই যে আপনারা আসুন এবং পরিষদের নেতৃত্ব গ্রহণ করুন। পরিষদকে আরো এই যে মূলধারা হোমিওপ্যাথির প্রধান ধারক এবং বাহক হিসাবে আপনারা প্রতিষ্ঠা করতে সহায়তা করেন। তো এই জন্য আমরা হয়তো সামনে জুলাই মাসে বা আগস্ট মাসে আমরা সম্মেলন করবো। এর আগে আপনার সদস্য হইলে আমার মনে হয় আপনি মনে করতে পারবেন যে বাংলাদেশের সবচাইতে যে কি বলবো এটাকে সর্বপ্রাচীন, সর্ববৃহৎ এবং মূলধারা হোমিওপ্যাথির ধারক ও বাহক একটা প্রতিষ্ঠানের আপনি সদস্য হলেন। তো এই আহ্বান রেখেই আমি আজকে শেষ করতে চাচ্ছি। আসসালামু আলাইকুম।
ধন্যবাদ স্যার। স্যার, আরেকটা আবদার অনেকেই করেছেন, আমাকে ব্যক্তিগতভাবে অনেকেই মেসেজ করেছেন যে আমরা যে আলোচনাগুলো করেছি বিগত দিনে ধারাবাহিকভাবে আপনি যে আলোচনাগুলো উপস্থাপন করেছেন ইংরেজি ভাষায়, তো অনেকে বলছে যে যদি সবগুলো পর্বভিত্তিক বাংলায় আলোচনা করা নাও যায়, অন্তত সামারাইতে হবে। এই অনুরোধটা অনেকেই করেছেন। তাহলে ভালো হবে। তো আজকের মতো আমরা বোধহয় এখানেই শেষ করতে পারি। সবাই ধন্যবাদ জানাচ্ছি যারা ক্লাসের শুরু থেকে এখন পর্যন্ত আমাদের সাথে যুক্ত আছেন এবং নিয়মিতভাবে বাংলাদেশ হোমিওপ্যাথিক পরিষদের এই অনলাইন ভিত্তিক উচ্চতর প্রশিক্ষণ ক্লাসে অংশগ্রহণ করছেন। আপনারা আপনাদের জায়গা থেকে যা অনলাইন ভিত্তিক এই প্রশিক্ষণ ক্লাসে যুক্ত হতে চায় তাদেরকে দাওয়াত দিতে পারেন। এবং স্যার যেই কথাটা বলেছেন, হোমিওপ্যাথিক পরিষদের সাথে যুক্ত হয়ে হোমিওপ্যাথির মূলধারাকে আর সবার জন্য দীর্ঘায়ু কামনা করছি, স্যারের জন্য দীর্ঘায়ু কামনা করছি। সবাই হাফেজ, আসসালামু আলাইকুম ওয়া রাহমাতুল্লাহি ওয়া বারাকাতুহু। এই কথা বলে